My first class, Allah. So I will be dealing with a beautiful subject called Materia Medica. In first year, they would have already introduced you to this particular subject. Any remedies already covered in Materia? Yet to cover a remedy. Okay. I feel the introduction part is done. Allah. Sources, science, philosophy, definition, all that you are clear. Okay. See, if you are clear with all that, today we will be starting with a very interesting topic. Now what is that interesting topic you have today is, what is the need to study Materia Medica? See, when you understand as a student what is the need, why you should study a subject, then your commitment towards that subject will be very strong. Okay? Now my simple question for you, for a second year student is, what is the need to study Materia Medica? Any one of you? Okay, one of your friends says to get a picture of the remedy. Beautiful, good. Now why should you get a picture of the remedy? Okay, to understand the symptom similarity. Good. Any other reasons why you should study Materia Medica? All of you study Materia Medica for this reason. You want to get a picture, you want to get a symptom, and you want to get a symptomatology. All of you, all the 72 or 80, you study for the same reason? You had a different reason. Yeah, what is the reason? Okay, very good, to prescribe. See, to prescribe a remedy, you should know the picture. It is all linked. Okay? But your aim is only prescription. Prescription is something which will come up later. Now what is your immediate aim? Why you should study a subject? Why you should study a subject like Materia Medica? Your immediate aim, I am happy none of you are talking of this. I know many of you have this in your mind, but none of you are coming up with. See, when you look at this, there are two things. The objective of studying Materia Medica is two. One is the present objective, and the second very important thing is the future, munde. So when you look at the present criteria, or when you look at the present need, why you study Materia Medica is all of you had this, but you are hesitant to tell. At least I assume you are hesitant to tell. Okay. So what is very important is, as a second year student, your immediate goal will be to pass. So your focus will be mainly exams. So the drug picture, the symptomatology is mainly focused on exams. Okay. Now if you are looking at the future, you should always look at accumulating knowledge. Okay. You should look at accumulating knowledge, and you should also remember the vast Materia Medica. And having a sound knowledge and remembering this knowledge will ultimately help you in prescription. Prescription is something that will come probably after 2.5 to 3 years. So the idea of studying Materia Medica will be of two folds. One is exams, the immediate goal, and second thing, which is a futuristic goal, which you all should aim at, is practice, is prescription. Okay. Now moving ahead. Now today's class will have three parts. One very important part is, what challenge or what difficulties you as a second year student will face when you study Materia Medica. That is the first challenge. And then we will look at the discussion, meaning we will discuss, and then we will also look at the solution. Am I clear? So, we are looking at three areas here. As a second year student, what challenges you will be facing, and we will be discussing those challenges, and we will also look at the solution. Okay. We will go ahead and you will understand. So learning Materia Medica, the challenges, and of course, we are looking at the solutions. Fine. Okay. Now what is my aim today is, before I take up a remedy, I wanted to give you an idea how exactly I will be teaching a remedy. Whatever remedy that I am going to teach you, what is it or how is it I am going to teach? That is what I am trying to focus in today's class. So this class will prepare you students to understand how I will be teaching a homeopathic drug. Okay. Now there are few objectives for today's class. This as a student may not be important for you. What is a name, what is an objective? You don't worry. You focus on the content. At the end of the class, which I assume will conclude by 3, okay? So you have to list the challenges in studying Materia Medica. That is the first objective that I have taken up, and describe different headings under which a drug is learnt, okay? And recognize a pattern of learning, meaning how am I going to teach a remedy? Fine. With the example of Apis mellifica, I will tell you, I am going to explain. And whatever challenges you have, we will look at some solutions. Okay. So these are the things that I have planned for today, and hopefully in this class we might take up only the first objective. Andre, what are all the challenges you as a second year student will be facing when you start studying Materia Medica? That is what we will be looking at. Okay. So as a second year student, what are all the challenges you are facing, when you study Materia Medica? Can I have some quick interaction? Somebody was using all the terms, I will be using those terms. Okay. Yeah, to interact as a student, what do you feel are the problems? Huh? Very good. One of your friends says, sir, it is very vast. How vast? Very vast. Very vast, very good, very vast. Good. Because we have never measured how vast it is. Many times they say homeopathic Materia Medica is like an ocean. Fine? Very good, beautiful. I am happy with the word vast. Good. Any other words that you can think of? Or any other difficulties that you can recall? ಏನು ಕಷ್ಟ ಹೋಮಿಯೋಪತಿ ಮೆಟೀರಿಯಲ್ ಮೆಡಿಕಾ ಓದೋದ್ರಲ್ಲಿ ನಿಮ್ಗೇನು ಕಷ್ಟ ಅಂತ? Okay, one drug might have many symptoms. Fine. He says it is vast, and one of your friend is telling, sir, one drug, under a drug you have so many symptoms. Absolutely right. There are 3,000, 3,500, 4,000. I am not threatening you. क्या सर आप डराने के लिए आए या पढ़ाने के लिए आए? Fine. Because, yeah, correct. Each remedy might have n number of symptoms, which again comes to what your friend is trying to tell you. It's very vast. Okay, good. Anything else that you can recall? Enappa? Very good. See, naturally when you talk of so many symptoms, when you talk of this being very vast, what is the other difficulty you will have? How to remember? Sir, आप बोल रहे हो ओशन, वो लड़की बोल रही है कि बहुत सिम्टम्स, तो हमारा लड़का को क्या आया? कैसा? How do I remember? How do I remember? See, we are yet to make an attempt to go through, but from the discussion, you have realized, how do I remember? Very good. That's the point, it will come up. Good. Anything else? Any other difficulties as a student? As a second year student? Okay, chalo. See, I mean, you told no remedies yet to start. Okay, so once you understand the remedies, you will come to know the difficulties. See, these are the things, too many symptoms. Fine. And which symptom to give importance? Out of those 3,000, 2,000, 1,000, 100, 200 symptoms, which symptom should I give importance? Fine. That's the problem. And as you start reading Materia Medica, you will get this feeling. What is that feeling? Everything is same. किसने लिखा Materia Medica? Everything looks same. आर्सेनिक का में भी सर का सिम्टम्स है, पल्सेटिला में भी सर का सिम्टम्स है. Fine. So what you as a student, a second year student, will get a feeling is all looks similar. These are the common problems students come to me with. Sir, everything looks same. Everything looks similar. And yeah, this is what your friend already told. How do we memorize or how do we retain all these things? And many of you students come up with one common thing. What is that common thing? Especially in Viva, no? We will be asking one question. You will tell some other answer. Some other question is asked, you will tell some other answer. And in the end when we start looking at you, then you will tell, sir, I am confused. Confused. Remember, this is the word you will be using, and which I don't want you people to use, because it's a beautiful subject, and if you understand the subject clearly, then there is no scope for confusion. Confusion agalla. Confusion agakke bidabardu. Fine? It's a beautiful thing. Okay. And few more things you will also come up with is, see, many of our materia medicas, the terminologies that they use, they are old terminologies. Andre, you would have seen books written in 1830, 1825, 1850, or early 19th century. Fine. And they would have used a lot of old terminologies, which are outdated now. So that can be a challenge. Okay. And one more very important problem a genuine student faces. A genuine student faces is, there are so many books on materia medica. I don't know if you have faced this, because I know you all read one book. Fine, so you will not have that issue. But as a genuine student, if you look at materia medica, there are so many books. Fine. So many books. Which book to follow? I will also tell you that which books you need to follow a little later. And I told you they look similar. Okay. So comparison, which I will slowly start applying in second year. What to compare, how do we get rid of the confusion? Comparison plays a very important role. Okay. And then too many particular symptoms. That's what I was trying to tell you. Sir se pav tak. Every remedy has a symptom to offer. Okay. So there will be too many particular symptoms. Done? There will be too many particular symptoms. Now, this is very important. See, these are all the common problems a student faces. Okay. Must be, as you come to first half of second year, you will get all these things coming up. Okay. So this is very important. Being a materia teacher, for a second year student, how exactly I will be teaching materia medica. Okay. So how will I teach a drug? See, when I talk of teaching a drug, I follow a proforma. What is proforma? Proforma means? Very good. What is it? Good. Order. I mean, a sequence, an order. Okay. So, what is that order or what is that proforma I am going to follow is very important. Okay. Now, this proforma that I am going to follow, I will be explaining, keeping a drug in mind, and this drug that we are going to discuss today is Apis mellifica. From your pharmacy, you know Apis mellifica is what? Honeybee. The poison of the honeybee is what we use in homeopathic materia medica. Okay. Now, to make this class more practical and more interesting, when a bee stings, what exactly happens? Many of you would have had, bee sting. There will be inflammation, there will be swelling, there will be redness, good. There will be pain. Any other things? Many people from rural areas, or urban areas, for example, you have a sting, honeybee sting. Pain, inflammation, redness, very good, swelling. That area gets swollen. Okay? That area gets swollen. See, and if you read this a little more in detail, what happens when a bee stings? Okay? What happens when a bee stings? You will have a lot of information coming up. Okay? These are images that I have taken from Google. Okay, you can just have a look. Now what you see is there will be swelling. Yeah, you see the face, you see the hand, the bitten part, that gets swollen, that gets inflamed. Okay. Now, there are also other things happening when the apis venom is poison. When the apis venom enters the skin, a lot of things can happen. What exactly happens depends upon your immunity, your susceptibility, how strong you are, how weak you are, how strong you are towards that apis poison or how weak you are towards that apis poison. Many might have had a sting, nothing would have happened. Okay? But for few, they go into bad reactions. Many have died. Fine? Not necessarily everybody will die. Few who are very weak or very sensitive have landed up with complications. Okay? So this is what I have taken from Google, and this information is very, very important. Now, why is this information important? Can anybody quickly correlate why this piece of information is important? Very good. Good. One of your friends says drug proving. Now, the beauty of homeopathy, okay, once you study the symptomatology, he used that word symptoms. Once you study the drug picture, okay, in your Materia Medica, you will be surprised to see that the person during drug proving, they have produced all these things. Are you getting an idea? Fine. So, what happens when a bee stings? And what symptoms a person comes up in apis mellifica proving, shockingly they are very similar. You are clear? Okay. So, to understand Materia Medica, especially a remedy like apis mellifica, first we should understand the effect of poison on human being. And then if you read the Materia Medica proper, things will be very clear. Okay? So you can go back home and you can just read, and I'll explain it further. Now, my teaching of a remedy will have an introduction, and this introduction could be a case. One of your friends said, "Sir, share your experience." When she said experience, she meant my clinical experience. Where have you given apis mellifica in your clinic? For what condition? Okay, that is what she meant. Fine. So, this remedy, many of our homeopathic remedies, they are already used as a medicine. I hope you know that. When you look at sources of homeopathic Materia Medica, what are all the sources? You said class has to be interactive. Good. Yes. What are all the sources? Huh? What are the sources of homeopathic Materia Medica? Very good. Drug proving or human provings. Then, very good. Accidental. Clinical. Good. Toxicological. Yes. Agreed. Empirical. Beautiful. Then, animal proving. Animal experimentation. Chemical. Fine. I mean, these were few things that doctrine of signature. Some 7 to 8 we have. Okay. So what you need to understand is, before apis mellifica was introduced into homeopathy, it was already used as a remedy for joint affections. Okay. People in olden days, they believed that bee sting can cure joint affections. That was a belief they already had. And you know, the common name of apis mellifica is honeybee. Yeah. Now, what is the part we use? Under introduction, we study all these things. We study about the common name. We study about the botanical name or the family to which it belongs to. Okay. What is the part we use? Okay. Now, what is the part? What do you understand by part used? For example, we have snake. Do we take the entire snake and grind it? No. So what are we using? We are using the venom. Okay. So when you look at a plant, We sometimes use the entire plant, or we might use only the leaf, we might use the flower, bud, seed, bark, root, or the entire thing. So part use becomes very important. Okay? Now any significance, why only that particular part is used? Any idea? As a student who have completed pharmacy, why only root is used? Why only flower is used? Why only leaf is used? Okay, very good. So what you see is, or what they have observed is, we need that part of the plant or any source which is highly active. Medicinally it will have good properties. Okay, fine. So from their experience or experimentation, they would have realized that this part has more of medicinal property, and they take only that part. Okay. See, entire snake will not make any big fun for us. Fine. Trituration in your pharmacy. This small jar and the entire, we need big things. But what is important for us? What is important there? It is the venom. So we take only the venom. Okay. So part use means, I am just giving you the explanation for the headings that we are going to use. Okay. So part use means which is that part that we are going to use. Okay. Now part used, and then we will also look at the way how it is prepared. How a homeopathic medicine is prepared. Okay. There are two preparations. Succussion and trituration. Fine. You have already done in your pharmacy. Now here Apis mellifica is prepared by the process of trituration. Okay. Now the part we use in Apis mellifica is the entire live bee. If you remember, what is it told in pharmacy? The entire live bee is taken in a jar, and they irritate them. Why do they irritate them? When you irritate, it starts becoming more vigorous and it starts stinging to the jar. So, there's more of poison that comes up, and then there are two methods. One, they use only the poison, meaning the venom. You have a second method where they use the entire bee and they triture it. Okay. So Apis mellifica, it is prepared by trituration, and now what is habitat? Now before I take up the next part, I'll again explain this, because this is my first class and I want you to be clear, crystal clear with what I am trying to explain. Right? So what do you understand by habitat? Habitat is a place where it grows. Yeah, where it exists, where it grows better. Fine? Students have issues with English, please feel free. I am going very slow. Okay, where it exists or where it lives. Habitat is a place where it lives. Fine? Like you should have seen from your pharmacy, few plants grow in dry area. Few plants grow in wet area. Few plants grow in hilly areas. It could be anything of that. Few goes better in China. Few goes better in India. Few in Japan. Few in US. Fine. So this is habitat. Where they are available, fine, and where they exist. The place where they exist. Apis mellifica, this is what I have just written here. The drug we study may be distributed in certain parts where they grow better. You understand? Few plants might also grow in India, but what is this? But they grow better in US because the climatic situation, the soil, the water probably is better there when compared to India. And few plants might grow only in India. They may not grow there because the climatic situations might favor that particular plant. Okay? So habitat, where it grows. Okay. Now, knowing the habitat helps us understand the remedy better. Okay. For example, there's a remedy by name pulsatilla. I'm just giving an example. Excuse me. Pulsatilla grows in a place or grows in that soil where there is less of water. Am I clear? So pulsatilla grows in a place where there is less of water, meaning it does not require too much of water. So how is the pulse patient? Pulse patient is a thirstless patient. You are getting my point? Pulsatilla person does not require more water. This is a doctrine of signature. It's a correlation we are trying to understand. So where it grows, it helps us to understand the drug better. Okay? Now where Apis mellifica is found? See, I am mixing two things here. What is it I am mixing here? I am mixing how I am teaching. Without wasting time, I am also introducing a remedy there. Artha agta idea? So with the remedy, as an example, I am trying to explain so that we don't waste time. Parallelly, we will be also covering a remedy. You have less time. Okay. So Apis, fine, where exactly it grows is very important. It is seen more in India, Asia, fine, Europe. Okay. Now, what is this? From the image, what comes to your mind? What is the next heading that I am going to talk? Huh? Correct. Very good. Good. Sources. Sources of not homeopathic materia medica. Source to which this particular remedy belongs to. What are the sources of homeopathy? I am not talking of materia medica. Don't confuse here. So, from your pharmacy, plants, animals, minerals, sarcodes, nosodes, imponderabilia. This is what, 6 minimum you need to remember. Now, where or to which source Apis belongs to? Apis belongs to animal source. Okay. So, under introduction, you will be writing source, or you will be seeing a remedy described under the heading source. Source means is a plant, animal, chemical, sarcode, nosode or imponderabilia. Clear? So Apis belongs to animal source. Okay. So this is just a small revision for you. Again, I am focusing on Apis. The part we use in Apis is the whole live bee, and it is prepared by trituration, and it is seen in India, Europe, Canada and the US. Okay. And it belongs to animal source. Done? So a small activity before I move further. Say we'll assume that's it to be the group 1. Group 2, group 3, band. Okay. So what is that question? I have a very simple question. From what I have thought, concentrate. From what I have thought, you have some small questions coming up. I know they are very tempting. 2 and 3, please control your emotions. Common name of Apis mellifica is honeybee. Very good. Keep it up. Good. Part used before question answer. Good. Very good. I like it. Good. Keep it up. So this is all what we have covered. Fine. Source to which. Good. See, you should keep up the momentum. I know this is very simple. In future something complicated, something difficult might come up. Your energy should be the same. Good. 3 simple questions. Honeybee, whole, and it belongs to animal. Okay, we'll go ahead. Any questions till what we have discussed? Or we'll have a quick revision. What did we discuss? I am trying to tell you the first component there, or the first part we spoke was, as a second year student, when you study the subject materia medica, what are all the difficulties that you come up with? Fine, that part we have discussed. Second part, we started studying a remedy named Apis mellifica. And I have just introduced you to a remedy. Apis mellifica is an animal, and before it was proved. It was used for what complaints? It was used for good joint affections. Part use, all that I have given you. Okay. Now we will try to understand further. Now this is again a question for all of you. This knowledge that I gave you just now, which subject you need to be sound, or you should have a sound knowledge of which subject to understand that particular knowledge. Very good. So what I am trying to tell you is, many times we read Materia Medica only as Materia Medica. Now this is where we'll have all those confusions, we'll have how to remember and all. Study the subject systematically, fine? Then you will not have any confusion. So knowledge of pharmacy will help you understand Materia Medica better. Okay, we'll go ahead. Now, what do you understand by prover? Many times we would have written Lacasis, proved by Dr. Herring. So what exactly you understand by that statement? So again, from the knowledge of pharmacy, what? There is a process called as drug proving. A group of volunteers, men, women, young, old, whoever, they prove a remedy. And that group is headed by one main person. Okay. That person is whom we call them as master prover. Okay. Fine. So when I say Dr. Herring proved Lacasis, it means he was not the only person. There were many, but he was heading that team. So credit is given to Dr. Herring. Artha? Similarly, Epis is proved by a person, by a doctor called as Brauns, B-R-A-U-N-S. If you are lucky, it can be a Viva question. Okay. Some examiner might ask you, who proved Epis mellifica? It may not be important for your practice. No patient will come and ask, doctor, who proved Epis mellifica? Nobody will ask. But for a second year Viva, it might come up. It's also given, the year is also mentioned, 1857. Okay, Brauns in 1857. But if you tell it very confidently, that's it. Okay. Now, this is very, very important. Now, what is that important part? When Epis, this is a picture you need to imagine. When Epis mellifica is taken, what is the process? Drug proving. When Epis mellifica is taken, okay, which area it acts? Okay. Fine. Now, this is what we call it as? Beautiful, good. Speed of action, absolutely right. Now what is speed of action? When a remedy is taken, please understand, these are all the vital words. I am purposely going slow so that things are clear. Okay. Now when I talk of sphere of action, I mean to say, when a remedy is taken, which organ or which system it affects. Okay. So which organ, which system it affects, that is what we call it as sphere of action. Done? So, going back to the first slide, what happens when a bee stings? If somebody would have read that slide quickly, you can now answer which part Epis mellifica acts. This is what we call it as sphere of action. Remember, sphere of action. Okay. Where exactly Epis mellifica acts? Epis, where exactly it acts? Now this is the anatomy. Right? Now where exactly Epis mellifica acts? Now before we take up where exactly Epis mellifica acts, we will try to understand what is sphere of action. Okay? Every class I will not explain all these things. First class I am giving you a brief idea. Sphere of action andre eno, prover yaro, part used andre eno. This every class I will not explain. Done? Okay? So, now what is sphere of action? I have typed few things, but from your understanding, what is sphere of action? We just discussed, So, each remedy has an affinity to affect certain parts of your body. Okay, that is sphere of action. Fine. Now, why this is important is the first question. As a student, you should know. See, whenever you get this word why in your mind now, then if you get a solid answer for that, you will be convinced. As a student, you should have that intuition. Why should I know sphere of action? What is the use of knowing sphere of action? That question should come to your mind. Okay? The second question is, to understand sphere of action, what other subject knowledge you should have? 1 second. I know you are, I mean you are quick. I like that. Fine. But please do understand this question. To understand sphere of action, which other subjects are very important? See, what am I trying to do here? I am trying to correlate materia medica with anatomy, physiology, pharmacy, and pathology. Very good. One more very important subject, toxicology. Sphere of action. Fine. Arsenic poisoning. किसी ने आर्सेनिक लिया, पिया, गया, तो हमारा काम क्या? ये आर्सेनिक लेने के बाद क्यों गया? तो क्या करेंगे हम लोग? काटेंगे. Fine? I mean, we do PM, postmortem, and we try to understand. We take a tissue from lungs, we take a tissue from liver, microscope में देखेंगे क्यों गया, क्या हुआ. So that is what we understand in toxicology. So toxicology knowledge contributes you to understand the knowledge of toxicology will help you understand materia medica better. So what I was trying to tell you, which majority of the things you have answered, a sound knowledge of anatomy, physio, toxicology, pharmacy and pathology, they help us in understanding the sphere of action better. Okay? Understanding the sphere of action is very important in understanding the core. Fine? As a futuristic thing, when you start practice, when an apis mellifica patient comes, fine, for example, very recently, I know it's too early to start cases for a second year student, but very recently we had a lady who had huge swelling of both the limbs. We got her echo done, we got her kidney test done, HB done, all normal. But she's got huge swelling with bad pains, she was crying with pains, and it was pitting. It used, on pressure, it used to leave a depression. So that lady, I had given her apis. I'll explain a little later. Okay, slowly we'll start cases, but try to go with the flow. Okay, so sphere of action, some knowledge of all this will help us understand the remedy better. Very important. We'll go ahead. Now we'll look at the sphere of action of apis mellifica. So I'm doing two things parallelly. Fine. I'm explaining sphere of action, and we are focusing on the sphere of action of apis mellifica. Okay. Now there are two things you will have to remember. Sphere of action is one thing, and the second thing is pathogenesis. Now what is sphere of action and what is pathogenesis? Any idea? Have you come across these two terms? Pathogenesis is? What is it? No, you need to be clear. I have also plugged my ears. So, unless you are loud and clear, I can't hear you. Any idea what pathogenesis is? Huh? Okay, can you make it more simpler? There is some point, I don't deny. Okay, see, very simple. Sphere of action is where it acts, and pathogenesis is acting on that. What is it doing? It might be structural changes, or it could be anything else. So sphere of action is, for example, apis mellifica will act on liver, assume. So that is sphere of action. Now what is pathogenesis? Acting on liver, what is apis mellifica doing? Is it causing inflammation? Fine. Or is it causing hepatomegaly? or is it causing cirrhosis? A step ahead understanding is pathogenesis. I'll explain now. See, for example, Apis mellifica acts on the cellular tissue. What is this? What is this? Apis mellifica acts on cellular tissue. It means sperefaction. What should be the next question coming up? Yes, acting on cellular tissue. What is Apis mellifica doing? Okay, it is causing edema. Edema means accumulation of fluid, naturally swelling. Okay, so edema is what comes up. Okay, and similarly, Apis mellifica acts on the mucous membrane. Fine. Okay. Now, mucous membrane from which subject you will know? Anatomy, physio. Fine. So that's why the knowledge of anatomy and physiology is very important in understanding materia medica. Okay. You know fans working? Okay. Chalo. Now, I mean, no remedies are over yet, but then which are all the other remedies acting on the mucous membrane? Okay, this question will skip for time being because this is your first remedy. Let's not worry about that. So acting on the mucous membrane, Apis mellifica will cause edematous inflammation, meaning it is not simple inflammation, there is also a lot of fluid getting accumulated in the interstitial tissues. Okay? So sperefaction, for time being, we have discussed two areas. First is cellular tissue. Yen madutte? Edema. Don't forget, it's a key word in Apis. Edema. Second is mucous membrane. Yen madutte? Edematous inflammation. Good. Now we'll go ahead and we'll try to understand. Any wild guess from the knowledge of anatomy, which is the part I am going to discuss here? Don't look at my face, my anatomy. Kindly have a look here. You know, what is it that I am trying to focus? There is something common running. Huh? Okay, good. Chalo, aur aage, thoda aage. GIT, but there are other systems also shown. Huh? Agudu, bere, talenu ide, brain ide. Huh? What is that common thing? You know? Yeah, they are all vital organs, agreed. Okay, good. Bere. Aitu, good. Huh? One word is missing. The anatomy that we are trying to focus here is serous membrane. You agree? What is that? See, brain is covered by a serous membrane. What is it called? Meninges. No. Similarly, lungs, pleura. Similarly, abdomen, peritoneum. Similarly, like the other areas that we'll be discussing. So, serous membrane. Apis acts on first cellular tissue. Second, mucous membrane. Third, serous membrane. Acting on serous membrane, what will Apis mellifica do? Very important. This is pathogenesis. It will cause effusion. From your clinical anatomy, what do you understand by the word effusion? Very good. Good. Accumulation of fluid. So serous fluid gets accumulated. Okay. So this is what we call it as effusion. If it happens in the brain, we call it as, what is this? Hydrocele. Good. Hydrocele. If it happens in the abdomen, peritoneum. If there is fluid in the peritoneal cavity, we call this as ascites. Similarly, pleural effusion. And if there is accumulation of fluid in the scrotum, okay, then we call it as hydrocele. Andre, tomorrow in your clinic, if you get a patient with hydrocephalus, if you get a patient with hydrocele, pleural effusion, ascites, one of the remedies, I don't say, please give Apis mellifica and dekho kal subho dekho sab. I mean, I'm not trying to tell you that. One medicine, one of the important medicines for effusion is Apis. Today I have told apis, tomorrow one more teacher will come and tell one more bryonia, one more teacher will come and tell arsenic. Now what happens? This is when confusion will start. Fine? But how to get over the confusion is what we will try to understand. Focus on the class now. Serous membrane. Okay, effusion is the key word there. And not only serous membrane, it also has a beautiful action on the female genitalia. Fine? You know, ovaries, fallopian tube, uterus. Specifically, apis has action on the ovaries. Your friend rightly said, ovaries. You should have heard of a common condition. 8 out of the 10 girls in Bangalore are suffering. How many? 8 out of 10 girls. Very difficult condition to treat. And what is that condition? PCOD. Polycystic ovarian disease. Apis is again a beautiful remedy. Please don't take apis directly. Apis should have its own symptomatology. What is the principle of homeopathy? What is that? Similia similibus curantur. Correct, Allah? So only if that lady will have symptoms of apis, which I will be describing, only and only then apis mellifica will work. Clear? Not every case you can give apis mellifica. PCOD, low. You can't give apis mellifica like that. Fine? And that is the beauty and that is the difficult part in homeopathy. 10 लोग PCOD आ जाएंगे आपके पास, सारे 10 लोगों का एपिस नहीं ले सकते आप. Fine? That is the difficulty. But if you give the remedy correctly, PCOD ऐसा चला जाएगा. But correct देना वो process है ना, वो थोड़ा मुश्किल है. Okay, we'll get back. We'll understand. So on the female genitalia, predominantly attacks on the ovaries and it is causing ovarian cyst. I just told you ovarian cyst. Okay. Now another area. Whenever apis comes, what should come to your mind is kidneys. Okay. Inflammation. See now, which subject becomes important here? No. Anatomy we have already done. Physio, patho. You are getting my point. See, this is anatomy. Khatam. Iske aage. This is pathology. Kidneys is anatomy. Kidneys is physiology. Uske aage kya aata hai? Pathology. What? Fine. So nephritis, inflammation, kidney failure, Bright's disease antive. It can be a beautiful remedy. So the knowledge of pathology plays a beautiful role in understanding materia medica. We'll go ahead. Skin. You know, skin is where the bee stings, and you know what happens on skin? You see all those red rashes. Fine. So what you have to remember here is there can be edema or there can be erysipelas. Okay? Yeah. Erysipelas. You know what is erysipelas? Again from knowledge of pathology, these are all skin lesions because of staphylococcus. Streptococci. And it will cause red eruptions, very red eruptions on the cheeks. Idina now is streptococci, not staphylos, streptococci. Okay, bacterial infection and it generally happens over the cheek. Erysipelas, and this is urticaria. You know the urticaria. There will be red rashes with bad itching. It disappears after some time. Urticaria. Okay. Huh? Yeah, I will tell you. Erysipelas, urticaria, edema for time being. Okay. We'll go ahead. Now, one thing that you commonly see here, from the knowledge of anatomy, what is that common thing you are seeing here? Can somebody take a wild guess and let me know what is that common thing you have here? Huh? What is that common thing? Ovaries, testes, tonsils. Okay, let me name it to you so that it might be more easy. What are they? Huh? Very good. Good, beautiful, good. Glands. So apis mellifica is a glandular remedy, meaning it is a remedy which predominantly acts on glands and it will cause swelling. Okay. Now, to understand sphere of action, there are two very important books you need to refer. One is Physiological Materia Medica by Dr. Bird and a Manual of Pharmacodynamics by Richard Hughes. Okay. Yeah, now we'll come to group 2, 1 and 3. Relax. Relax means you focus, but group 2 will answer. Are you ready? Group 2. Yes. Okay, this is what you are trying to recall. Action of Apis mellifica on serous membrane. Very good. One word, effusion. Hope all of you are clear. Effusion. Okay. Second thing is, which part of the female genitalia Apis mellifica acts? What is the action of Apis mellifica on ovaries? It will cause ovarian cyst. Good, beautiful. Acting on which part Apis mellifica cause erysipelas? Skin. Good. Clear? Simple. Okay. I'll stop here. I'm done with my time, 3 o'clock. Okay. So to sum up, in today's class, what did we do? We started a remedy Apis. I introduced you to this remedy. We spoke of introduction, common name, and part used, mode of preparation, habitat, prover. Who was the prover? BRAUNS, Brown. Okay. Now you are asking for the spelling. This is the spelling. Okay. So bronze was the person who proved. Then we spoke of very important part of Apis, and that was the sphere of action and pathogenesis. Okay. We have covered very little in Apis. I am not bothered about the time. Don't worry. But the question is, are you all clear with what is explained? All of you. Boys, girls, fine? All of you. Any questions to ask? Any questions? If at all there are any, we'll take it up. If there are no questions, next class I will continue with Apis mellifica. We are going very slow. Apis might take 5 to 6 hours. But first remedy, I am not worried about the time. It's worth it. Once you understand Apis now, my way of teaching, then we can speed on it. But let's not hurry in the beginning. Any questions? All clear? Chalo, thank you.